Hey you, are you interested in what inpatient physical therapy is all about? Would you be interested in learning and listening from an actual working physical therapist that works in the hospital? Well, in this video interview, I had the joy and the opportunity to interview Dr. V, physical therapist that works in an inpatient acute rehab setting. At the time that I interviewed her, I caught her in a very unique transition where she just recently graduated Doctor of Physical Therapy School and started working as an actual professional physical therapist. So whether you're in the transition from graduating DPT school and getting ready to work in the professional life, or you're just interested in what the heck inpatient physical therapy is about, be ready to have your horizons and perspective changed. All right, let's get to the interview. Lego. All right, hello, Miss Veronica. How are you doing?
Very good. Very excited.
All right. So I found you, those of you guys who are listening here, I found Veronica on Instagram. She just popped up on my feed. I follow, I think, the hashtag pre-PT or physical therapy thing on Instagram, and then I see all her wonderful and authentic posts, and I was like, dang, who is this? And I'm reading, you're like a new grad, new PT, you're working in like an inpatient setting, stuff like that. So just for all the people who are listening now, could you just give a little background on just like where you graduated from, where you're working, and then why you started your whole like Instagram, like this whole side PT thing?
Yeah, sure. So again, my name is Veronica. I'm a new grad physical therapist, and I'm a new grad acute care physical therapist. I graduated from Western University of Health Sciences just this year in August. So I'm literally like brand new. Like I still feel like kind of a student still. It's like this weird transition period. And yeah, I currently work as an acute care PT in a hospital in South LA. And yeah, really the reason why I started this PT life, the Instagram, is because I just wanted to start out documenting this interesting transition period, like I said, between being a student to suddenly you're the PT, you're like the clinician.
Ed Honcho, yeah.
Yeah, and like it's just a wild transition because literally 2 months ago, I had a CI like watching over me and making sure that I was doing everything right, and like sweating.
Yeah.
And then now like there's no one. It's just me. Like I have a schedule and go see your patients, and I'm like, oh, okay.
Like no one to say, can I go and see them now? Or
Yeah, exactly. Well, aside from the nurses, but yeah.
right. Yes.
Yeah.
Crazy.
But yeah, I just really wanted to document this period in time, and I also thought it would just be beneficial to others to see that this is like a weird point in time to be a new grad physical therapist. There's a lot of anxiety. There's a lot of, kind of imposter syndrome, but then there's a lot of excitement as well. And there's just like, you have all of this wealth of knowledge and you're just gonna go out there and be, the professional that you've always wanted to be. So it's like this crazy period, and I just wanted to just share my thoughts and my experiences. So Instagram was the way to go for me.
Yeah, I mean it's really cool because I mean if you like look at your feed, everything is like it's like I feel like I'm following a storyline, It's like you started here and all these thoughts of like, what about this situation as a new grad PT? Like it's like, oh, there's a post that covers it, and then you have a good story about like how your experience went. I think there was a story where like a patient like peed on you or something like that,
Yes,
which is pretty common in the acute setting.
Mm-hmm. Yeah, that was like one of the better stories actually. So
Yeah, I think it's just super cool that you're just so authentic with your posts, and everyone who lands on your page, it can really like resonate and be like, oh, like I understand that, or I resonate with that, or oh, I can really see how I could go and get into that situation when I graduate or anything. So, all right. So, I know you work at a inpatient setting,
Mhm.
and physical therapy has so many different realms: inpatient, outpatient,
Yeah.
acute, neuro, ortho, peds, all of that stuff.
Mhm. Yeah.
Why did you choose inpatient?
So I've liked inpatient from I had a clinical rotation, my second one, which is an acute rehab rotation. So that was inpatient, but it was cool in that I also saw a lot of neuro cases. It happened to be a stroke certified hospital, and I just was really like loving it. I just love seeing the progression of patients, and I noticed that I love seeing the progression from a very low functional mobility state to getting them to safely go home. I like found that it was just really fulfilling to me. So that's what really grabbed my attention towards inpatient.
Right.
And yeah, just like making, I don't know, just being that vessel. I think like one of my posts like said like just being a vessel for change. I really felt like that vessel of change in the inpatient setting, and it just made me like want it even more.
Yeah,
Uh,
that's
but
nice.
yeah,
Did you
yeah,
always want to do inpatient, going into PT school, or like?
right. So before PT school, I actually had very little inpatient experience. I
Yeah.
think the only experience I had was hands off. I was like standing there just observing
Dang.
at the inpatient setting.
I feel like that's
Um,
way more than most people. Most people don't even
yeah.
get inpatient experience at all. Like I
Wow.
never had any. Yeah.
Right. Yeah, and it's just a tough setting to get observation hours anyways.
Right.
So like I got the minimum like 20
Right.
hours, which is like really nothing. You're
Yeah.
not getting the full taste. And I think I finished it in 1 week. So I was literally in the hospital setting for 1 week, and I was like, all right, check that box.
Right.
Like I can apply to PT school now.
Right.
Cool.
Right.
But yeah, it was really that one rotation that like opened my eyes and made me realize like I think I can really enjoy this setting. I'm already learning so much, and it's a good like it's a good challenge for me too, because like they're pretty low level, and so there's an element of like you have to keep them safe, but you also want to progress them. So how do I teeter along the lines of pushing them, but not pushing them so much to where it's unsafe and they're desatting and
Right.
blood pressure is dropping. So it's like a lot of critical thinking that I think like, yeah, that's just enough challenge for me.
Yeah. I think, a lot of people will go into PT school or during PT school and think like, oh, acute care or inpatient, like it's
Right,
so lame or whatever. But
right.
honestly, like I think it's like high stress, and it takes a lot of critical thinking, like way more than you think. But it's like in such a fast like pace. Like
Yeah.
outpatient ortho, you take time, you can
Yes.
think about it in like after a week by week process, but this like literally happens in a matter of 10 minutes. Like I make the decision of treating, or I say, nah, I'm not, depending on like your
Mhm.
chart review,
Yeah.
your level, blood levels, all that kind of stuff. So
Yeah, yeah, definitely. And
I,
like, especially in the acute, my setting is acute care. So literally patients are only there from like 3 days to at most like 2 weeks.
mhm,
So you just really have to progress them to at least be safe to go home. So like, it's just a lot of short, you're right, like a lot of short making that you have to do quickly because it's so critical for the patient.
right, absolutely. And I'm sure all those patients are in great hands because of you.
Thanks.
So tell
Appreciate it.
tell me a little bit about a day like in the life of an acute care physical therapist.
Like, what does it look from A to B?
Yeah.
Is it kind of like up and down or pretty mellow, or like the types of patients you see kind of thing?
Oh, gotcha. So yeah, so I'm one of 5 physical therapists, and the hospital, and we cover the entire hospital. So that's the ICU floor,
Right.
the emergency room.
Right.
You got your med surge floor. You got your tele floors and everything. So my day can super range because I don't know what floor I'm gonna go into. I don't know which evals are coming in. So that's also kind of the exciting part of my job. I literally walk into the office, I'm like, I don't know what my schedule is gonna look like. Here we go. So yeah, so I go in and I usually get my schedule, and it typically ranges between like 7 to 8 patients for a PT. For a PTA, there's a little bit more because they're mainly doing treats.
Right.
My day is mostly filled with initial evals.
Right.
So I have to take a little bit longer. So yeah, so I do all my chart reviewing at the beginning of the day. So that'll take me about an hour or so to make sure that I read every vital note from the doctors, make sure I read all the kind of diagnostic tests like CT scans, your x-rays, and make sure that like I know all the weight-bearing statuses.
Yeah, that's huge.
Like, yeah, a lot of people might think like chart reviewing for an hour, like you're wasting a lot of time. It's not. It's so vital.
Yeah.
So yeah, that's the beginning of my day. And once I feel like I have good enough notes and have a good enough picture of the patient, and then I go start my day. So for each patient, I make sure that I call the nurse that's assigned to that patient to make sure that they're clear for physical therapy. If not, if I don't get clearance from the nurse, I don't see the patient. That's just like the hierarchy, right, in the hospital. And yeah, mostly my evals encompass me seeing their bed mobility, seeing how they transfer, and then seeing how much they walk. And then from there, my initial evaluation, what the care management team really, really looks at is where do I recommend discharging the patient. So that's what the big role of PT is in the acute care setting. We are like kind of the biggest insight for doctors, nurses, and social workers on where should this patient go. Are they safe to go home, or do they need to go to a SNF?
Right.
Or if you have a homeless patient, are they safe to go to recuperative care, or are they not, and we have to send them to a SNF? Right. So like there's like, so yeah, that's what I would say is the main purpose of physical therapy. Like we're already thinking, or physical therapy in acute care actually.
Right.
We're already, from day one of initial eval, we're already thinking of discharge and where are they going.
Right.
Which I feel like that's something I'm just now learning within the last month of working here, because I didn't really get this understanding in PT school. I don't know if you have, but this is all like kind of new learning for me.
I think when I was there, my CIs always challenged me and said, where do you feel like the patient is appropriate to go to? Because they're not going to stay in the hospital forever. Because it's acute care, right? They're in there just to like get good enough to leave. But where do you feel it's appropriate for them to go? Like, is it acute care? Is it a SNF? Is it home, like you said?
Exactly.
Is it like intensive care? Like, are they appropriate for that? So, like, I know there were certain criterias where it was like, you have to make that cut, or you have to maybe treat them a little bit, like skillfully to make sure that they get the best care, maybe, long term. So, I know it differs, but yeah, I remember I was at those crossroads and I was like, what? Like, skilled nursing, like I make that decision? That's weird.
Yeah, right. Yeah. And like what I'm learning a lot that I feel like PT school, it's just impossible for PT school to cover insurance. Like, that's like a whole new learning curve for me, because like if they don't have good insurance, you got to try to make them independent. If they have good insurance, that's really good. We can get them the DMEs they need. We can get them home health. And so this is like the weird nuances of being, one, a new grad, and then two, like the whole healthcare system as a whole. Like insurance, I don't know. Insurance is just crazy.
Yeah.
Like,
It's really cool to hear, like, you know, everything is so fresh in your mind. Like, I could tell, like, I like how it's like you are not quite sure about certain things, which makes it really relatable to someone like me or students in PT school, because it's like, you know, you don't have all the answers, and that's good. Like, that's okay. You know, and obviously as you continue in your years, you're gonna learn. But like, it's really if it makes me feel better. Like, okay, like she's there. She's been there for several months, like 6 months now, like half a year almost. Or how long have you been? Yeah,
a month and a half.
a month and a half. Okay, well, even then, I mean, it sounds
So
like you know all your stuff. But I mean, it's like this unique opportunity to catch you in this time, and it's so great because you're like, you just came from PT school and you're in PT, you're actual PT, and like no one, that space is not really there as much. So like, I'm super grateful that I caught you at this like moment, you know.
Yo, really quick, if you're getting some litty ass knowledge bombs from this video, please do not forget to like, subscribe, and hit those notifications so you don't miss out on any content like this.
Okay, so while you've been working there for a month and a half, what are some pros and cons that you can kind of tell me? Like, if you can name 3 pros, 3 cons, what would you say those would be?
Okay, so I'll start out with the cons because I just want to end on a good note.
Okay, all right.
Cons. So my particular company requires a 80% productivity, 80 to 85% productivity, which is just the name of the game. The hospital is still a business. Ideally, I just don't want to think about productivity. Like, I came into this profession being there for patients, like having patient care and being able to connect with patients. And I feel like knowing that there's a productivity like threshold that I have to hit, it kind of like takes away from the patient care aspect for me. Like, one time I was treating a patient, and like, this is the first time I ever did it. Like, I had to look at my watch to see that I was like kind of taking too long in this treatment, and I needed to see like 3 more patients. And like, that's the thing I don't like. Like, ideally, I want to spend a whole hour in this room because this patient really needs it. But because I have to hit a certain standard to just like keep my job, I have to cut things short. And that's just how having a job is. So yeah, like, I think that's probably the con for me. Just that the patient care aspect is a little bit dulled with the business aspect of things, which I don't really like. Let's see. Another con I would say is I noticed there's a lot of misunderstanding of what PT is. Like, literally, like, I think people just think we walk patients, and sure we do. Right. But if you think about how much you walk every day, we have to walk. We need to make sure that these patients can walk, 200 feet, because that's how much you walk out in the community or just in your own home. And like, we need to see that you're safe to do that, because if not, you shouldn't be going home. Right. And like, yeah, and I just think like, just across the board, from patients to even other healthcare providers, I think there needs to probably be more education on why physical therapy is there and why it's so necessary and why our clinical judgment is so important. Right. Yeah. So that's probably another con. And probably my last con, which isn't really that bad, I've gotten used to it already, is like there's weird smells, sure. And you'll see weird things. I've seen a lot of butts and genital regions, but
yeah. You know what? I wish someone told me about that. I saw genitals every single day.
It's just they have gowns that float here and there, like it's cool. Like it's not really that much of a con now for me.
Right. But all right. Another penis. There we go. Cool.
All right, let me cover you up. All right, we're ready to walk. Let's go.
Oh, that's funny. Well, I'm glad that one you're getting a little bit more. You're building a tolerance to it.
Yeah, definitely.
When I first started, I was like, "Oh my god."
Yeah, I've definitely there's definitely times I've helped nursing change the patient and they're in the bed and they just take off the gown. I'm like, wow, that patient's fully naked. All right, cool.
Let's move on.
Yeah. So just heads up for anyone out there thinking of acute care, just know you're going to see some body parts.
You're prepared, yeah.
Or a lot of body parts.
Oh, yeah. All right, and then how about some pros?
Okay, some pros.
I know you got a lot. You love talking about where you work.
Yes, I just love physical therapy, especially in this setting. One, I think I've been saying it a lot, we help patients get home safely. They don't want to be in the hospital, and we don't want them there for that long. So our goals are always the same with the patients, let's get you home. So just everything from just education and just strengthening the patient by walking, or teaching them safety, is just so fulfilling, because a simple thing like making sure that you use your walker all the way to the bed, and they're like, why? And I'm like, well, you need to be safe. You need to make sure that you make it to the bed. Right. Don't put your walker to the side. And a lot, it's just crazy. All the patients are like, oh, I didn't know that. And I'm like, yeah, it's just the little things that PT can do is really, I don't know, it's a big reminder that this profession is so important just for the safety of the public. Right. And I think at least the hospital I'm in, I'm grateful that they really hold PT, they really have been valuing PT. A lot of times, we are almost sometimes the barrier between a patient going home, because we don't feel safe letting the patient go home. Right. And ultimately it's the doctor who decides, but at least we put in our clinical recommendation that they don't go home. So I just the safety aspect, I guess, would be that bullet point of PT in the hospital. Another pro, oh gosh, another pro. I just have so many. In another pro is just I'm sure a lot of people went into PT for just the human connection and the patient connection. And you can do this in any setting. I just seem to personally like the inpatient setting, because it's just a really vulnerable time for a patient. They're really sick. They're really weak. Sometimes I've had patients that were just intubated. So this is just a vulnerable, tough time for a patient. And I just like knowing that I can be there, to one, listen to them, because I'm there in their room for a long time, so they can just talk and vent to me about, man, I can't even poop on my own. I'm like, I'm sorry about that. So just being a listener and just being able to connect to the patient, it's a really great opportunity to have that if you're someone that likes that patient connection. Mm-hmm. Hospital is a cool place to do that.
Yeah.
Yeah.
Definitely. And I know, I didn't really understand this until I got into PT school and then learned with patient interaction, but listening is like so powerful.
Yes.
You know,
Yes.
like just sitting there and listening can actually heal and help the patient recover, like expedite the recovery process. Just like
Yeah.
a good listener. And you know, I don't know if it's a guy or girl thing, but I'm a terrible listener. My wife tells me all the time, like, you need to listen. So
Oh,
I'm
dear.
definitely working on it through this profession. It's like I'm
Good.
grateful for it, you know, kind of thing.
It's helping your marriage.
It's helping my marriage, helping my profession. It's like a win-win. So I get better learn how to listen.
Yeah. You hear that, folks? PT can help your marriage.
We should start a podcast for this.
Oh my God.
I see it now.
No, but yeah, I definitely agree. Because, like, also what's cool is, like, the hospital's so fast paced that a lot of times, like, nurses and doctors, they're so busy. And, like, I totally understand that. But sometimes, like, it's cool that we get to spend, we have to spend an extended amount of time with them. So we're like that special, unique profession that has to spend a lot of time with them. So we have the ability to listen to them for an extended amount of time.
Right. Yeah. So I know listening is a huge characteristic that a physical therapist should have. But in your opinion, in addition to listening, what maybe one or two characteristics should a PT have that you feel would make them very successful or thrive in the physical therapy world?
Gotcha. I've always said this. You should be very good at being adaptable. Especially, I guess I'm just talking about like the inpatient setting. But I think this can apply to just the whole PT world, but things can change in an instant. Things are so like fast paced with a patient. A patient can be walking 1 minute and then just desat, and you need to be quick on your feet and adapt and figure out how to be safe with them. So I think like being adaptable and being okay with kind of tough situations and figuring out how to make sure that you and your patients are safe is going to be a really important key. And like, no one's perfect at it. Like, I feel like this is a skill that you can just build upon, because I definitely don't think like I'm there yet. I think I'm still learning. I still feel like I'm like kind of slow at it, but it's just something you can definitely continue to develop along your career. But yeah, so adaptability, and I think, you know, we've kind of touched up on this, but really having that human connection, like having empathy, understanding, because sometimes like your patients are in a lot of pain, and there's going to be a lot of healthcare that's going to just kind of like shoo them off and just be like, okay, you're just that patient that's
Right.
a lot of pain. Or like I'm sure you've had like chronic pain patients in the outpatient setting, and they're like, oh, they're always 9 out of 10 pain. But can you imagine like living your life believing and feeling and just living in a state of like 9 out of 10 pain? That's like terrible.
Yeah.
And like you said, sometimes listening and just showing them that someone's there to listen and understand their certain situation can actually like help them like decrease that.
Right.
So yeah, just having a very good people connection and being very personable will definitely, for sure, help you out in the PT field. Because I think like I've said this before to a few friends, like I feel like skill wise, even though you're not great at skills, you can always improve on that. But your people skills, like that's a little tougher to fake and build up.
Right.
So yeah.
You know, one of my CI, this reminds me that one of my CIs, when I was an inpatient, he said, you know, as a physical therapist, we are probably one of the only people that these patients are going to see for like a good amount of time. Like all the doctors, all the people who take all the or maybe the nurses, you know, they're with them, but like the duration of interactions that you have is like a long time, like
Yeah.
30 minutes, 45 minutes, whatever it may be. Well, as an MD or a doctor might come in and be like, hey, how are you doing? Good. You need some medicine? Okay, cool. All right, bounce. Bye.
Right.
So that, you know, in that moment, that's like something that physical therapists have like a very unique role in
Yes.
just the whole healthcare experience. And
Yeah.
you know, I think that was a very big eye opener when he told me that. I was like, wow, that is you got a point there.
Yes, definitely. And that holds super true in the hospital setting. Like
Right.
us and nursing, we
Mhm.
spend
A lot of time together.
yes
Yeah.
with the patient.
Right. So in your inpatient setting, just a couple more questions for you. In your inpatient setting, are there any kind of habits or mindsets that you kind of practice that you find makes you like a better physical therapist, makes you more productive, or anything like that? Or some things that you should avoid that maybe people who are going into the clinic now or who are thinking about being in the inpatient setting should try to practice?
In general, I'm just in my mindset, especially I'm just gonna speak to the state that I'm in right now, which is like new grad, super new grad PT,
Mm-hmm.
like fresh out of PT school. My new mindset that I'm really trying to practice every day is to be okay with not being perfect, or to be okay that I'm not at my peak and that I'm still learning every single day. Yeah, I guess that's my phrase, just to be okay with it. Because really, like, no one's perfect. And like all the experience and great mentors and PTs that you have, they've been here at our particular state. They've been a student, they've been a new grad PT, and like they got to that point by making mistakes and learning and growing. So I think like the biggest thing I'm trying to practice is like just really trying to grow through every bumble and every big mistake that I make. I just like try to take it as a learning opportunity and just be better tomorrow.
Ooh, preach it. Preach it. Wow.
Yeah.
Yeah, I think you know, that'll encourage a lot of students who are interested or trying to get into the same world that you're at. So thank you for sharing that.
Yeah, thanks.
One of the last questions that I wanted to ask you was, if a student, like let's say a college student, undergrad student, was trying to get into PT school and was kind of like, I'm on the fence. Like, I don't know if this is for me because doctor of physical therapy is such a big jump from like a physical therapy assistant or, you know, undergrad student. And it's like DPT. It's like I have to take all those prereqs and have all that training prior. Is there anything that you would like to say to those particular students, maybe from your own personal experience, on maybe encouraging them or giving them any kind of words of wisdom or anything like that?
Oh, gotcha. Yeah, so if you're on the fence about PT, I'm always like, I'm just so biased. I'm gonna be like, just go for it.
Right.
If you like a profession that is flexible, if you like a profession that has just a crazy wide range of settings, you can go all the way from sports medicine to where I'm at, like acute care setting. You like, and if I choose to tomorrow to be like, I'm gonna go outpatient, I want to go back into sports, I can do that. And there's just like a lot of job stability in that, even though you want to switch like different roles. There's actually like a colleague of mine right now, she's working part-time in outpatient. So she's doing both the outpatient, inpatient, because she wants a taste of both. So like I think like physical therapy, if you're unsure about it, I like honestly honestly say go for it, because no matter what, you're gonna find that niche or that setting that's gonna just really jive with you and just really be your thing, because there's just such a wide array of what like there's no one definition of PT. There's just like a ton.
Yeah.
Yeah. There's like wound care. Like there's wound care to even, I've heard PTs working with Broadway companies.
Oh.
Yeah, like because they're moving every night.
Yeah,
They need to take care of their bodies. Like I'm learning every day. I'm learning of a PT that works in just this obscure setting that I would never think about. But that's also just the beauty of it. Like PT is so wide and so open. So in a way, PT is just so welcoming in that sense.
Right.
So I would just say, if you're worried about the like how much work it is, how much worried about where you're going to end up, I would say just don't worry about it. If you like patients, if you can work hard towards school, and you just like really value healthcare and just really value helping people and being a healing hand, PT is like the way to go.
Wow. You are speaking to so many students right now. And I know what you just said is going to impact so many students that just heard what you said. Thank you for sharing that.
Thanks.
All right, well, Veronica, thank you for your time. Like, this has been like just the most wonderful and great experience to be able to interview you, just run into you. I'm really excited to hear what you're gonna have to go through and hear about how you're gonna deal with that in the future. If people don't know you, where can they find you? Like your IG handle and all of that stuff.
So mainly it's just one place. I started an Instagram. It's at this PT life. So go ahead and give me a follow there. Hopefully I grow to other platforms, but right now it's just the one Instagram platform. So go ahead and give me a follow there.
I'll make sure to put that in the description in the video so people can definitely know and follow you.
Awesome.
It's worth it, you guys. Well, thank you for your time, and we'll talk to you soon, okay?
There are a ton more fields in physical therapy. So if you want me to cover any of those fields or specific niches in physical therapy, make sure you comment below so I know exactly what videos that I should put out. So I hope this video helped inspire some self-change to expand your horizon in the diverse field of physical therapy, and especially in the acute rehab setting. Change people, change people. That's why we live for change, people. Stay lifting, stay aloha. Have a great one, you guys.